Welcome to our third session and our Consumer Insights Zoom series for High Value Nutrition Consumer Insights. Today, our researcher is Dr. Ivy Gan, and she's going to be talking to us about research that was conducted in the very end of 2018, Chinese doctors' attitudes to diet and health. For a number of reasons, we haven't managed to go public with these results yet. So this is the first time that anyone is hearing them, really. There is a full report available, but Ivy's going to go through the top line findings today. Thanks. So just before I get started, I'll just go through the quick agenda for today. I will start off with a few etiquette tips, just because you may have noticed we've got open mics on today. It's a webinar. It's not a webinar, it's a Zoom meeting. So later on, we'd like to keep the interactivity going and give you the opportunity to talk directly to Ivy and Denise, who are the researchers who conducted the study. So we'll go into a bit of etiquette about how to make that run smoothly. Then, of course, I'm going to swap over to Ivy, which is the reason we're all here today. She's going to speak for about 25 minutes. Then we're going to keep it interactive and have a Q&A session. Throughout the session, Joanne Todd, our challenge director, is going to be online. So if you've got any questions you'd like to direct at Joanne, specifically about more high-value nutrition itself, some of the contestable funds, those sorts of things, please direct them through and she'll be able to answer those at the end of today's session. Right. Oh, thanks. Okay, so very quickly, when Ivy's presenting this afternoon, if you've got any burning questions during her talk, if you could please just post them using the chat function. So type them in using the chat function at the bottom of your screen. I'll be going through those as she's talking and collating sort of similar themes to pose to her and Denise at the end. Once Ivy's finished and we're into the true Q&A session, I will attempt an open mic session. Obviously there's a few of you online, so we may need to manage that so everyone's not talking at once, but I'm sure we'll be fine. For now, if everyone could just leave your mics on mute until the presentation's over. And I just wanted to make the point that these sessions are being recorded for later access. So if you don't want your video to appear in those recordings, you can turn your camera off now. Whilst you can see names on the screen now, they don't show up in the recording, so don't need to worry about those. Okay, that's about it for me, really. So the focus of today is hearing from Ivy and then later from Denise about this data. So I'll hand over to Ivy now to talk to you about Chinese doctors' attitudes to diet and health.
Cool, thank you, Tracy, and hello again, and great to see some familiar names on the screen, and a big warm welcome to those who meet us for the first time, and thank you for being part of this. And for those who don't know me yet, my name is Ivy, and I gained my PhD in marketing from the University of Auckland, and now I'm a consumer research at Plant and Fruit Research. It has been a great journey to be part of HVN since Tranche 1. And I'm very grateful to have this opportunity to share with you our consumer insights work done in China. In Tranche 1, we did intensive work with consumers through focus groups and in-home interviews to learn about their life with health conditions. And after talking to consumers, we would like to have a look at the doctor's opinion, because doctors were definitely part of our conversation with consumers, and it's part of their life living with their health conditions. And we would like to see whether doctors' perspectives and views are aligned with those of consumers that we collected previously. So Denise and I team up again and we return to the field. Today I'm sharing our interviews with doctors in China with regards to their observations of their patients' health and dietary behaviors and their perceptions of and attitudes towards new food products with proven health benefits. Before going deep to the study, I'd like to give you some brief background information regarding the healthcare system in China. So there are different types of hospitals in China, from general comprehensive hospitals, which are usually dominated by Western medicine, but also with a TCM department, and TCM specialized hospitals and hospitals of integrated traditional Chinese and Western medicine. There are also some ethnic medicine hospitals and other specialized hospitals and clinics. And there are lots of community healthcare centers which serve as the first point of contact for mild symptoms or for regular checkups of like your blood pressures, things like that. Although there are also many private hospitals available in China, public hospitals still play a leading role in the medical health care system. And according to the most current classification, hospitals in China are graded by a 3-tier system that recognize hospitals' ability to provide medical care, medical education, and conduct medical research. So there are primary, secondary, and tertiary hospitals. And tertiary hospitals are comprehensive or general hospitals at the city, provincial, or national level with a bed capacity exceeding 500. And hospitals then further grade into 3 levels according to their service provision, size, medical technology, and all sorts of criteria. And tertiary grade A, which we simply called AAA, are those with the best medical resources, well-respected and prestigious hospitals. And yeah, people can just go to different types of hospitals according to their symptoms and their preference for different types of treatments. And TCM is something that you can't avoid in China. It's interwoven within China's deep and rich history. Although in recent years, there are lots of debates going on regarding the practice of TCM, the strong link to traditional Chinese culture of TCM still makes it very influential on the daily life of many Chinese people. And in terms of diet and health, the most important TCM philosophy is moderation and balance. Everything shall be in balance. The yin and yang, the hot and cold, meat and vegetable, and never not too much or too less of any single element. And in the medical care system, TCM also plays an irreplaceable role, and it's supported by Chinese government, and the networks of TCM medical service have covered both urban and rural areas. And I personally have very little experience visiting a doctor either in China or in New Zealand, but I'm aware that the experience of visiting a doctor is quite different in these 2 countries. As far as I know, most individuals in China don't have their own GP. And if they need to visit a doctor, they don't even and if they don't have an appointment made in advance, they need to register on site, and most possibly they may end up queuing in a long line for a meeting with a doctor. And also, if you want to book an appointment, you'd better be clear about your symptoms and which department you are going to visit for this symptom. And if you have a specific doctor that you want to visit, you need to have that in mind as well. And this time we did in-depth interviews with doctors in Shanghai, and we spoke to 14 doctors. Half of them are with TCM training, and the other half with modern Western medical background. And to align with HVN focuses, these doctors are mainly handling with patients with metabolic and or gut health issues. And they were all working for AAA hospitals, as mentioned before, and these are the highest ranking for hospitals in China. And doctors are of a mix of genders and years of experience in their practice. Some photos from the field. We didn't go into doctors' office or their home, and we invite them to meet us at a meeting room. And again, Interviews were conducted in Mandarin by me, and Denise was there accompanied by a sim translator, so she was also fully involved in the conversation. We also visit some local pharmacies, and as you can see from the left, this is Shanghai #1 dispensary, the city's largest independent retail pharmacy. It is stocked with 4 levels of all kinds of medical supplies, including TCM, tonic, supplements, functional foods, and it's standing at the prime location of Nanjing Road, which is one of the world's busiest shopping streets. And I'm sure you won't miss the big black malls banners at the back. And in that building, you won't be surprised to find some very pricey Manuka honey as well. And the doctors share their observations with us. And the 2 biggest trends observed by doctors were that in the digestive and metabolic areas, the number of both irritable bowel syndrome, IBS, and diabetes patients increased rapidly over recent years, while many of these patients present with symptoms at an earlier age. For the reasons, doctors attributed this to the adoption of high-fat, high-salt diets, life stress, and unhealthy lifestyle limits exercise, and environmental pollution, that's air quality, which is quite consistent with what we were told by consumers. And some doctors also acknowledge that the ability to identify this disease earlier is quite important and contributing to the increased number of patients. For example, the common practice of annual health check help many people to get to know of their health conditions at an early stage. And this is particularly helpful for metabolic issues and like the triple high that we talked about last Thursday, as this can be easily learned from the abnormal readings. And here are some figures from doctors shared with us in the interviews. Typically, a doctor may need to handle 100 outpatients or even more on a daily basis, so they are very busy. And in the Department of Internal Medicine, doctors deal with a mixed group of outpatients with diabetes, digestive issues, and a wide range of other problems. And in the Department of Gastroenterology, patients with IBS symptoms account for 20 to 30%, and among these 20 to 30% are returning patients. And in the Department of Endocrinology, diabetes patients are the most common, accounts for 60 to 90% of the total outpatient, and 60 to 70% are returning patients who mainly come for regular checkups and to collect their prescriptions. And in general, doctors are quite busy. Only 3 to 5 minutes will be given to a patient on average. And this busy work schedule of doctors in China leaves very limited time for mutual communication of detailed dietary behaviors and suggestions between doctors and patients. So in terms of doctors' suggestions for patients, they report that they mostly the same story with what consumers have told us. Doctors will suggest their patients to change their diets, mainly less sugar, less salt, and less fat, do more exercise, do not stress too much, and take medicine when necessary. And for patients with mild symptoms, it's very important for them to self-manage their conditions, and doctors have to deal with those in more serious conditions. And in terms of patients' adherence level, doctors also acknowledge that patients may have all kinds of challenges or excuses, such as I have to attend a very important business dinner, I spend too much time and commuting, so I'm tired and have no time to cook at home. or I don't want to do outdoor exercise because the air is not good, or just simply many of them can't control their mouths and they want to eat whatever they like. So the level of patient adherence also depends on their level of education, income, and knowledge. And as you can see, there's a gap here. Doctors are quite busy and more focused on taking care of those who need medication treatment, and they are not generally trained to give ongoing consultancy or guidance of the nutrients and healthy eating, things like that, which is quite important for patients who with these mild but chronic digestive or metabolic issues. So the gap between consumers' need for professional nutritional advice and the limits access to these resources has been found in the study. And there was also reported the dietitians and nutritionists are not yet very commonly available in China. So in terms of their suggestion on diet and nutrition, doctors reported that they would just give some general advice. And without systematic and continuous guidance, many patients can't control and can change their diet for long. So this is an example. The doctor said that she has returning patients who will smile at the doctor and admit that they didn't follow the advice, although they know that following the advice is important. They just try their luck and hope the symptoms don't come back. But that's always not the case. So the doctor was also concerned that this kind of disease is consuming a lot of medical resources. And on the other hand, even doctors found it very challenging to maintain a healthy diet. This doctor stated that he'd like to eat natural food and avoid chemical food or food with additives as much as possible. But he also admitted that it's very difficult to choose your own diet, and it's not something that you can decide on your own. And again, if patients want more specific guidance or suggestions, doctor usually have no time or not have that specific knowledge for that. And yes, it's quite common that patients make inquiries about specific foods or supplements and seek advice or recommendations from doctors. But most doctors we interviewed reported that they seldom actively recommend supplements or certain food items to patients as part of their treatment package. They stated that it's not their obligation to recommend certain items, and doing so would make them appear unprofessional if they were related to a specific brand or a specific product. And in general, doctors appear to be less interested in food products with health claims than the patients did. But here we need to understand the context. Doctors were facing many patients with more severe conditions which require more medication solutions, and more of their attention were paid to medication treatments rather than functional foods and supplements. And during the interviews, we specifically asked doctors about two old sayings which were related to medication, drugs, and food therapies, and these two sayings were very popular among Chinese. The first one is every drug is toxic, or every drug has its side effect, as I also mentioned last week in the first talk. And doctors argue that food therapy is definitely good, but medication are necessary for treating illnesses and diseases. And the other saying was drugs are not as good as food therapy. And doctors also saw that this is mostly applicable to normal conditions rather than people who have serious conditions, in which case medication is necessary part of the treatment. So functional foods or supplements were not very much appealing to doctors in this regards, but doctors are quite okay for ordinary people to improve their health through nutritious food or any type of food therapy. But again, nutrition and food therapy was neither their specialty nor their priority in medical practice. So in the interviews, many doctors expressed their concerns of the vague boundary between food, supplements, and medicines in the current health product market in China. They were cautious that many of these health products contain unclear ingredients, or they suspected some of these products may have included pharmaceutical ingredients so that they do appear to be effective on some symptoms. And from the perspective of doctors, they think such a mix-up of these concepts of health products could be misleading to their patients. For example, some patients may tend to use these products to replace medications, and this can be risky for patients who do need medication to cope with their conditions, like control their blood sugar or blood pressure. And as one of the doctors said, she's not opposed to these health products, but he opposed the situation that these products contain unclear ingredients and don't have clear side effects on the instruction. And another big concern was the lack of regulation of health supplements and food products in China. And many products have false claims on their health benefits and use an unrecognized ingredients or contain pharmaceutical ingredients, which may also interfere the current treatments that the patients are taking. Although these doctors seem to be not very positive towards the current health food product markets, when we explore their attitudes towards new foods with proven health benefits, theoretically, they were open to the development and innovations of new food products which can help improve their patients' health conditions, as long as these products are effective and the previous concerns with ingredients and the credibility are addressed. And doctors as health professionals are more capable in evaluating the effectiveness of these health claims than consumers do. And just like what they did when asked by patients and friends about certain supplements or functional foods that they were not familiar with, doctors can utilize their medical knowledge, which they gain from different sources, like medical guides and training they received and their experience throughout their practice to evaluate the ingredients, the functions of the product and its claimed benefits. And with their professional eyes, they would specifically evaluate the credibility of the clinical report which supports such claimed health benefits. And external accreditations also give some extra hints. These include certifications, authorizations, and the brand reputations. As for doctors with Western medical training, clinical reports are the most pervasive thing regarding the effectiveness of the product. But TCM doctors, actually, they also received a substantial proportion of Western medicine training. So they would also refer to clinical reports as a credibility cue. But also from a TCM perspective, knowledge and experience were reported important as TCM doctors evaluate the products on a case-by-case scenario depending on patients' personal conditions. And the TCM-based evaluation may consider the nature of the ingredients, which are either they are warm, cold, or neutral in the nature, and how the nature of the ingredients can help to achieve a general balance for each different patients. And according to doctors' knowledge, there are some possible ingredients for new food products to deliver health benefits for digestive and metabolic patients, mainly probiotics, gut flora, and digestive fiber. And doctors also express no preference of the forms of new food products, as long as these forms can be easily adapted to patients' normal meals, be convenient and easy to replace their current genres of foods. And there are still some concerns surrounding the long-term side effects, especially when additives and preservatives may be involved in the products. And they also think that if the product has an unpleasant taste or flavor, then the patients may not be able to keep consuming that product. And the price, fair enough, if the price goes too high, then the acceptance may be at a lower level. We also ask about doctors' perceptions of New Zealand with regards to the levels of technological achievement and innovation advancements. And most of the doctors thought New Zealand was less advanced in technological advancement achievements compared to the States and European Union, including the achievement in medical area. But New Zealand was perceived as having an edge in food innovations due to its well-protected environment, which provides high-quality food ingredients, and the well-respected food safety regulation of New Zealand also help to guarantee the quality of food products. And yes, a quick summary. Doctors are a type of special stakeholders in the market of new food products with health claims. And sometimes they act like a gatekeeper for their patients and friends, family members. Although doctors do not actively pay much attention to current healthy food product markets unless they were inquired by patients and their friends. But they do share the common goal of health improvement with patients. So doctors were basically open to, but very careful about foods with health claims, and they require scientific proofs from credible clinical trials and reports. And they want to see cases of actual product performance from both the Western medicine and TCM perspective. So they are capable of going through a very professional scrutiny of the product. And doctors also perceive that medications are for curing, while food therapy is more for prevention or recovery or maintaining health in daily life. So they wish there shall be a clear boundary between the two with regard to medical treatment for their patients. And due to their areas of professional and the types of patients that they are mainly handling with, medication still holds some more priority for doctors in their practice. And this again reminds us of the gap between consumers' general need for more nutritional advice and the doctor's lack of capability to meet these needs. And the insights that the nutritional value and knowledge of the new food products with health benefits have to be carefully communicated to the audience. And doctors are less active in seeking for food therapy solutions, but they would be inquired by patients and friends who are interested in this product. So in this case, doctor's evaluation would be given on that product. And finally, quite consistent with consumers, in doctors' eyes, New Zealand country of origin image still have a great brand power for healthy food products. So yeah, New Zealand companies can keep on leveraging the brand New Zealand effects. And yes, I guess that's all from me at the moment, and welcome to ask questions. And I will hand it over back to Tracy at the moment.
Thank you so much, Ivy. That was great. Now I'm going to invite Denise Conroy to join Ivy up on the screen. And they are going to together answer some of the questions that have come through whilst Ivy's been talking. So thank you for those of you who have asked us a few questions. There's some really good ones here. Firstly, a couple here about the fact that doctors aren't really trained to give advice on nutrition, yet there don't seem to be many dietitians around. So a bit of a question around where people get advice on eating for health, and then a suggestion that, well, a question, I guess, about whether nutritionists and dietitians are co-located with medical specialists to sort of work together to team up to provide advice or not. Thoughts on that?
I'll start it and Ivy can come in. So the way that things are at the moment is that the only trained dietitians are in hospitals, and there are so few of them that they only see extremely serious cases who are inpatients. So there's no external appointments. In the time we've been doing this, we've seen things starting to change as more demand comes on and people have stopped being so concerned about getting any nutrition to getting overnutrition and the issues that some people are facing now with their health. We did ask consumers where they got their advice, and the two most popular places were personal trainers at the gym and also the beautician at the beauty spa. So we did actually interview some personal trainers and beauticians, and yeah, definitely not trained. Definitely no idea.
Yeah, as I shared on one of the slides, one doctor told us that in their hospital they have 1,000 beds, but only 10 nutritionists to cope with these hospitalized patients. So these nutritionists are so overwhelmed dealing with those patients who can't even eat normally, and they rely on nutritionists to provide nutrient solutions for them, because they can't even eat normal food. So there are not many dietitians and nutritionists available at the moment, but we can see there's a trend that there are more of dietitians and nutritionists available in China, and also from lots of social media channels like WeChat accounts. There are some I also subscribe some of these medical accounts, and they will push lots of articles talking about general nutrition knowledges which can be applied to average people rather than people have really special conditions. And for these people, it would be advised, even in those articles, if you do have some specific conditions, go to seek for advice from doctors rather than just simply following these generic suggestions. And at the end of those articles, I can see they always have a note saying stating the author of these articles. They do have some nutritionists for either to write up those articles or as a reviewer of those articles to make sure these the contents of these articles are actually professional.
Thank you. Right, I've got a couple of questions here relating specifically to TCM. Firstly, can people go into a TCM dispensary and talk about their symptoms and get a recommendation or a prescription much as we would the Western pharmacist? Does it operate the same way?
As I said, I personally have very little experience either visiting a doctor or visiting a pharmacy, and I can recall one of the occasion that I did went into a TCM herbal drink shop, which is just at the corner of the street where near where I lived in China. And I wouldn't call him a doctor because I guess it's not right, because I didn't check for any certificate, things like that. But he did ask me what's your symptoms, how I feel, and what I want from this herbal shop. And then according to all my descriptions, and yeah, he also did some observations, like seeing my tongue, things like that. And then he did mix up some of the solutions available at the herbal shop, and finally give me one bowl of the herbal tea. So I guess in some way you can get some general advice from the staff in the dispensary.
Great.
But it's not that professional level, I guess.
Okay, so quite different.
I think they did seem to be very much dispensaries. The very large one that Ivy showed a photograph of, which Ivy and I got told off in. We were taking photos and we almost got kicked out because we kept taking photos. So it was really that people were turning up with prescriptions to the counters, although there were hundreds of thousands of products there. It is amazing.
Okay. Right, Dyson's online here and he's asking, what is your recommendation on educating Chinese doctors on specific ingredient benefits? How or can we influence their decision-making process? For example, the Chinese market is saturated with traditionally well-known ingredients. How do we break through with new ingredient education? What does New Zealand food quality, well, this is a bit of an adjunct, what does New Zealand food quality mean to Chinese doctors? Example, manufacturing quality versus efficacy.
We did actually ask this question of the doctors, where they were influenced in terms of where they would go for information that they would feel was reliable and authentic. And they're all very busy people, and they said that they rely a lot of the time on when they're at conferences, at people being at the conferences. So most of us have probably been to conferences where there are stands around with people selling books or products or whatever, and they would like that interaction to be able to talk physically with someone, but also have some evidence, literature that was trustworthy, that would support the claims.
Yes, different from consumers who receive information from quite a wide range of different channels. Doctors mainly rely on those professional channels that they feel is recognized by the medical community, and and they may refer to medical guidelines. So if the new ingredients has been included in those kind of really authentic materials, then they may be very interested in learning more about those new ingredients.
Okay, and I've just got a little bit more on that question, relating more to New Zealand. So any thoughts on what does New Zealand food quality mean to Chinese doctors? That's looking probably at our manufacturing quality versus efficacy, whether they're seen as equals.
Yeah, I think as Ivy had a few slides to say that we're well respected in terms of food and the food that we produce, not just in terms of the food itself, but in terms of our processes and the trustworthiness that is in the entire supply chain, which, unless you're got an understanding of the supply chain in China, it's hard to understand just how important that is, that the entirety of the system can be trusted, and that the products are very well respected in that regard.
Yeah.
Dyson, feel free to turn on your microphone if you'd like to ask anything further about your question there.
Hi, how's it going? Dyson from Convenient Marketing. Yeah, just on that question about New Zealand food quality and efficacy. What I mean is, in China, I guess what we understand is there are a lot of, traditionally well-known ingredients, and although some may not have that specific quality, but because it's local, and nowadays there's a whole emphasis on trusting local goods and local brands. So just saying that whole quality side of things make it varied in the whole Chinese medicine sense. So yeah, just hoping to understand, in New Zealand, we want to provide Chinese consumers with trusted and well efficacious products. But there's it seems like there's a whole conflict between Chinese traditional medicine, or trust in Chinese traditional medicine, and imported goods currently. So how do we, I guess, as a New Zealand company or brand, break through a whole market confusion, if that makes sense?
Yeah, I'll have a go to start with. I think that in traditional Chinese medicine, it's not just about the product, but it's about the provenance of the product. So you can have the same ingredient, and it would be costed quite differently depending on where in China it was sourced from. So provenance is very important, and having a narrative around that provenance and why the importance of that provenance exists is also really important. So I think that understanding that is something that we need to take into our New Zealand products and make sure that we can have that connection as well.
Yeah, I can add on a little bit on that. For TCM, it's quite important that you specify where the ingredients is from, because the potency of that ingredient may be related to the soil, the climate, things of that, because the TCM philosophy is, include all the elements in that case. So TCM doctors may specify that for these ingredients it's better from the northern part or from the southern part. But one of the problems for that at this moment is that many places of China are suffering from heavy pollution. So for some like TCM herbs, you definitely grow from the soil, but if the soil is contaminated, polluted, then definitely the quality of the ingredients may also be contaminated, reduced. And so in this case, the New Zealand natural environment and the protection of the environment can be a good story, because we are not polluted by like heavy metals, or the air, the water quality are pretty high, and this can help to secure the potency of the ingredient. And as I know that some ginseng planting in New Zealand, and they are promoting that these ginseng are growing in New Zealand and from a very natural environment, and they just market it as one of their selling points with the New Zealand, the the very wide used ingredients of ginseng and the good environment of New Zealand.
I think, just adding a little bit there, I think the other link we have is for many Maori people, there are various plants that have been used for a very long time as their traditional medicine. And so linking these stories together and making that part of the New Zealand story, again, gives Chinese people access to the narrative that you're trying to create.
Yeah, and based on that, if you have some other uniqueness which can be linked to your own product, just like Manuka honey, it's quite unique. It's something that you can only find in New Zealand. You can't find it elsewhere. If you can find some sort of this uniqueness, then yeah, it would be a good story to tell.
Great, thank you. And hopefully our rapid recovery from COVID might signal more of our good health credentials and so forth going forward. Dyson, does that answer your question? Are we all good to move on?
Yep, definitely. Thank you.
Perfect, thanks. Okay, I've got a question here from Tony. He makes organic blackcurrant powders. So he's got a question around how something a bit unique or not usual within the Chinese market might be accepted there, given that the powders are quite tart, quite sour, and Western consumers here might tend to put them on breakfast cereals or in smoothies or with yogurt, which is perhaps not so conventional in China. What's the likelihood of this sort of product being picked up, and how might people choose to consume it, given it's not common?
As we said before, Chinese consumers are actually quite open to novel food, and there's something on top of my head. If you can give them a solution, like you're not just giving them the blackcurrant powder, you give them a whole solution how to use this powder and on what occasions you can use it. Either you add it into the juice or just the westernized style of breakfast with cereal, as long as you teach how they can experience these products, rather than asking them, well, this is product, you try it whatever ways that you can have it. I guess definitely the former is a better way. And I recall from another study that asking about food labeling, and people are actually saying that we want more instruction of how I can do with this product, either how I can cook it, or how I can combine this one with other ingredients or products. So if you give them a more complete concept of product rather than just the ingredients, then the acceptance may be higher.
I think I'd just add to that, actually giving them a reason as well. What is the benefit of the product? So high vitamin C, for example, is really important, because then you're giving them a complete story.
Great. Tony, I don't know if you're still with us there. If you'd like to, hopefully that's answered your question. If not, if you'd like to turn your mic on and just address Denise and Ivy.
Yeah, thank you for that. I guess the question was also more around a Chinese consumer is more likely to take food, health from food or health from a supplement? And is it better maybe to try and market our products as a supplement rather than a food?
I think that's really mixed. It depends on who your target market is. And we're definitely seeing people looking towards food, but at the same time, the supplement market is huge in China. But there's starting to be concern amongst some consumers about authenticity of product because there's a lot of fraudulent product on the market, and that is seen as being a little bit less in a whole food or a functional food. But I really think that you need to define who your target market is, because then we're better able to perhaps say how they eat and what their preferences are, and where they go to for information.
Yes, definitely. If you know, well, I guess you just need to determine who you are targeting, and also which formats, either whole food or supplements, is your way to go. And then because China is just such a vast market, either whole food or supplement will find their portion. Yeah.
Okay, we start. Sorry, Tony, are you okay there? You got anything else to add?
No, all good. I was just going to say that's good. Thank you. Thank you very much.
Thank you. We started to touch a little bit on claims, and Roger has asked, how much weight or clout does a health claim from another country, such as Australia or New Zealand, carry with Chinese consumers or doctors? Any inklings?
This is a really complicated one, to be honest. On the one hand, the consumers we've spoken to really value health claims from a country that they see as being trustworthy, such as New Zealand or Australia. On the other hand, they sometimes question whether the product will have the same effect on somebody who is not Caucasian. So were the tests done, even if they were done in New Zealand, were they done on Chinese people, for example? We got quite a lot of pushback about products that have had clinical trials, for example, done just in China, that a lot of the consumers would reject those and say that they would be just fraudulent unless they'd been overseen by a quality university in, say, New Zealand or Australia. So it was it's quite a difficult one to answer. We asked about the blue hat, which some of you may be familiar with, which is a very expensive label to achieve. And I think of all the people we spoke to, which included the doctors and all the consumers we've ever spoken to, probably no more than 2 people actually recognised it or knew what it was for. So.
Roger, I don't know if you want to turn your mic on, if you've got anything else to add, or if that's answered your question comprehensively.
Yes, I realise it is complex. So, yeah, no, that's good. Thank you. Appreciate that.
Okay, well, I guess that's all the questions I've got written down and on the chat at the moment. So if anyone does have any questions, I'd just like to open their mic and address to Denise and Ivy, or keeping in mind we've also got Joanne Todd on the line if you want to ask any more sort of overarching HVN questions, please do so now. Okay, that makes my job easy. We don't have to worry about managing lots of talk over the microphones. So that's pretty much our session for today. I did just want to finish by directing you to the full and comprehensive report that's been prepared regarding the material from all of these interviews with doctors in China. There's a slide coming up in a moment which will show you the HVN website. So if you're not familiar with the website at this point, please go on there. There's a treasure trove of material there. All of our consumer insights reports are there. You need to go to the right-hand side of the screen that I've circled there. It's called the knowledge. And if you don't have a password, just request one and that will come through to you in a day or two. And all of the full reports are in there. So please go in and have a good look. Our next session is going to be on Thursday at 2 o'clock. You should all have the Zoom link coming through. Well, should have it in your diaries now if you want to get along to that one. We're going to have Dr. Denise Conroy addressing us there, and she's going to be talking about trends in social media in China. So this is a really interesting area, and she's been to a conference and she's learned all sorts of new and exciting things there. So that's going to be a good one on Thursday at 2 o'clock. So hopefully we'll see a lot of you again then. So thank you very much for attending, and at the very end of all of this series, so the end of this week, I'll send out a short survey to everyone just to get a bit of feedback on how you've found this particular way of delivering some of these insights. So take care, have a good day. Thank you.
Thanks, everyone. Thanks.
Bye.